and no good cancer talk without a survival curve. So walk us through kind of the impact of having these different mutations on overall survival in anaplastic thyroid cancer.
Yeah, so I think, why do we care so much? We care a lot because we know that the individual driver mutation, the mutation we think that's driving the cancer, actually impacts overall survival. Overall survival is something that you'll see in any oncology talk, and this is basically, estimating how long we expect someone could survive after diagnosis and with treatment. I can go into the curves a little more on some of the other slides to help understand it. But what this shows is those with a BRAF mutation have a longer expected overall survival, with those with a RAS mutation having the shortest overall survival.
Great. And let's go into some of the data that's helped define how we treat our patients in 2026.
Yeah. So we've seen anaplastic thyroid cancer change tremendously in the last decade. And this is thanks to a lot of research that, was total breakthroughs in the field. We saw that in 2018, the ROAR trial led to FDA approval of BRAF mutated ATC with treatment with dabrafenib and trametinib, which are a BRAF and MEK inhibitor. This was based on that we saw an overall response rate of 56. On the left, you can see what we call a waterfall plot. And you'll see the lines going down are patients whose tumors shrunk, and the lines going up are patients whose tumors grow. You can see that the vast majority of these patients with anaplastic thyroid cancer had shrinkage of their tumor, which is what we're wanting to see. Then if you go to the right, that's demonstrating how long people survived after a diagnosis of anaplastic thyroid cancer. Historically, before we had these targeted treatments, overall survival was around 5 months. You can see that with BRAF and MEK inhibitors and BRAF mutated anaplastic thyroid cancer, we saw overall survival go from 5 months to almost triple that at 14.5 months. So this was the breakthrough, what has started so much advancement in this field.